facial expression, I think, can tell us quite a lot. And it's not just, there's some science to looking at the facial expression of animals. And we'll go through a little bit of that. And I got very interested thinking, well, people that work with newborn babies, kind of a similar responsibility to us. They have to get it right, but these babies can't talk. So this is some work that was done actually in a hospital in Orlando. And they've been looking at what they call the primal face of pain in babies. So this is like every baby in Florida has to have a blood test when it's born to test for some specific genetic defects. And so what they did was they put a video camera above the baby's crib and started filming before, during, and after pricking their heel to get that little sample. So a very acute, noxious stimulus. And what they were able to find was they could actually get these specific markers on the baby's face and actually document with computer analysis what changes with acute stimulus. And so obviously this furrow gets bigger, the eyelids change, and all these things that a mother would obviously instantly recognize, but this can all be scientifically downloaded and looked at and can be used as a measure of pain in babies. The mouse pain face has also been looked at. This was published last year in the lab animal literature. And actually what they did was they had mice with abdominal pain and videotaped their face, and what they were able to start to pick up on was a cheek bulge, whiskers pulled back, and then this cheek bulge, whisker, and their head position. So there's no doubt that mice with abdominal pain have a facial expression that is very recognizable if you are used to looking at mouse faces. Now here's another one, again, looking at adults and trying to develop techniques for understanding pain in Alzheimer's patients. What does that facial expression really mean if they can't communicate? So these are people that are being videoed. You can do all this very complicated, map out their facial action units, and so on. Now, we've started actually looking at this type of technology and trying to develop it and look at what do cats do with, with acute noxious stimulus. So the next video I've got, I want you just to focus on the cat's faces. And this is me looking at the cat's face, and this is just a few of the ones I've collected as our students are trying to place an IV catheter. So just watch his face. Get it? See it? See it? Obviously the catheter didn't go in. So we're trying again. Oh, we're trying again. And then the next cat, you'll have to watch really quickly as the catheter gets in. Look, did you see it? What he did? So there's no doubt that there's facial action units in cats in response to an acute stimulus, and we're going to try and document that. So, facial expressions in cats. Yeah, it's a good one. So, I began to think there was something in it, because this is the pain scale that they show very young children. Please point to how you feel. So here, that's that cat, and that's this cat. So there's it's a little bit better documented than that, but there is something to it. So I have started looking at this, and here's a normal cat, head up, eyes are fairly horizontal in the head. Here's a cat that you've actually seen this cat already in the presentation, but we've just focused on its head now. Look at the position. His eyes are half closed, they're slanted, different altogether. And actually the whiskers are pulled back compared to this relaxed cat. So here's others. You start looking at these things again, before and after. This is Max, who had a degloving wound. Here he is when his pain management's really good. Here he is when things are not so good. And I've got some more pictures of Max. Look at that. Look at the difference between that and that. Big difference, right? So I think the face probably does tell us quite a bit. And, some people say, well, a lot of the drugs that you give for anesthesia will make a cat's facial expression change. And I went, again, it's a bit like a scared cat's going to get all hunched up. True, but it's different when they're painful. So here's a little cat called Nimbus who was going to have dental extractions done. Here he is before in that sort of like pretzel, kind of crouched. And so here's his face before we did anything to him. Then we sedated him with an opioid and ACE. And yes, I agree, his face has changed. But this is him after he's had his dental extractions. And I think you'll agree that it is different. And if you want to see it sort of for real before, during, and after, this is what the difference comes out as. So up at the front of the cage, friendly cat. He's like, oh, okay, you can stroke me. Then we sedate him, and there's a definite change in his expression, but he's still quite relaxed, got his little front paws, the pretzel position, looking at us. And then 3 hours after his procedure is over, where is he in the cage? He's at the back, yes. And he's breathing heavily. And some people might have an opinion on his tail. So very different. Facial expression can tell you quite a lot. So one of the things that came up in the Brazilian study is, what does the cat's tail tell you? I would say right now we're not sure, but I've got some videos of what cats' tails do after surgery. So this is little Max, the one with the degloving wound. And so we're starting to try and figure out, what does it really mean? We're not sure. It's a bit like vocalization. It's not as clear-cut in the cat. But you obviously, and here's another cat after orthopedic surgery, And, some cats do this just when they're annoyed, but could it be a pain behavior? And this needs, I think, a lot more before we start actually assigning flicking of the tail as a classic, pain behavior in a cat. So just to try and make you start looking at cats and dogs, just to even start looking for pain, we came up with these very straightforward, like 4 pictures that people should start looking at. And so this is the one. This is the normal, happy cat, eyes horizontal, open. We call it the croissant, but that was kind of for the French market. So maybe for us, it could be the bagel, and then we could have the pretzel for the Germans. And then we've got what got called the humpy, and this is the cat that's all crouched up after abdominal surgery. And then we have the squinty, which is the cat with the slanted eyes, and I'll look at the different, we did a diagram of that. And then we have the flat out, not a normal posture. And sometimes just putting these pictures up makes people start looking for these and starting to say, oh, I need to look at that cat a little bit better. And then there is this scale that you can download at the CSU website, and there's information, and it's actually in your handout as well. It's not validated, but it has a lot of the things we've been talking about here, and it's a 0 to 4 scale and has some good descriptors. And this, I think, can be used and can be quite useful as well. And then if you're going to start introducing a pain scoring system, probably the dog one I would definitely recommend would be the GLASGOW short form, which is it, again, in your handout. So now that we have better skills and better tools, let's look at that first dog just one more time. The dog that only scored a 2 out of 8, but everyone was going, he's not a 2 out of 8. So here he is again. So he's standing there. We've got an idea of his face. He's down. We're going to come in and try and get him to get up. Or at the moment, he's being asked to get up. He won't get up. He needs help to get up. The audio is not going at the time, but he is actually making not good vocalization. And then we just slipped in and tried to palpate him. Very, very tense. And then he did respond to us palpating his wound. So you all knew that was a painful dog, but the pain scale didn't say it was a painful dog. If you take the GLASGOW pain scale and now look at him, he was quiet. So on that domain, on the first one, he doesn't get a score. And he was at the time ignoring the wound, but he refused to move, so he got a 4. When we started palpating him, he was actually starting to growl and started to cry. So he gets, even if we took that out, he's going to get a high pain score. Everyone obviously agrees he's depressed and doesn't respond to us trying to get him to get up. So he gets a 4, and when we palpated, he's very rigid, he gets a 3. So out of a total of 24, he gets a high score. So when you do the appropriate scale, then obviously this is a dog, and the GLASGOW pain score, the recommendation is a dog that scores over 7 needs intervention. And so obviously this dog needed additional treatment. And if we go back to this little dog, I think this, in your handout, you'll see part B, 3 of the GLASGOW pain score is very important, I think. Dogs getting up. Will it get up? or does it refuse to get up? So the dog we already saw, and then that's the spaniel that lost his real dog shake when he was very painful, didn't get up. So this assessing how they get up when you first go to the kennel, I think is a very important part of that GLASGOW pain scale. So putting things a little bit together, trying to put all of those things. Here we're going to look at a cat, which gives us a few mixed signals. And we're going to see what you guys pick up on. So this is Levi, who had a horrible injury to his leg. They tried to save it for many weeks, maybe months. And then finally, the only solution to his problem was to amputate his hind leg. So, and there should be good audio on this. So just listen and watch carefully what Levi does after his amputation. He's going to mark his cage and then fall over.
Yeah, good boy? What's going on? Oh.
So again, if you aren't really in tune with cat behavior and stuff, his vocalization doesn't sound good. Did everyone figure out what he's vocalizing in response to? The dogs. Yeah. So lots of people don't, so you guys are obviously in the advanced group. A lot of people look at that and say, man, that cat just is growling away. And I go, I didn't really, if I thought he was really growling and going to go for me, I wouldn't have been in there petting him and doing all the other stuff. So he did lots of normal behaviors. He was eating, he was starting to groom, he was exploring, but the one thing that was a bit of an outlier was his vocalization, but you figured it out. It was because there's dogs barking, and, he's going to tell you that's not, the dog should shut up. So here's a cat, 4 hours post-amputation, and, people might say, well, 4 hours after amputation, he's kind of, doesn't look too, well, let's see. So he had a good protocol, and now we're assessing him. We're trying to palpate the wound, and there's something, that part of the wound is okay, right? But there's a part of the wound that's not okay. And we're going to see what he does. Look at his coat, look at his face. He is doing, turning around, trying to get down, trying to get comfortable. Doesn't like the catheter. Look at his face. Look at his breathing. So some people have looked at that video and said, considering that was, a huge hind limb amputation, that's not bad. Well, it might not be awful, but it definitely could be better. And so we've got a part of the wound that's really painful. We've got a facial expression that isn't, normal. We've got a cat that doesn't look like, I know it's only 4 hours post-amputation, but he doesn't look like he's groomed himself. There's some other issues that seem to be annoying him, and one of them would be a catheter. Because remember, cats have that very large part of the brain, the hatred of catheter center. And so what we did was we said, okay, there's a part of that wound that needs, additional. So we actually put some local anesthetic infiltration into the wound. He received another opioid, and we took out one of his catheters. So then when you see him afterwards, you'll see completely different cat. And this is maybe only like an hour, a little bit over an hour after we intervened and took out that catheter, cleaned him up. Now what have we got? And he's had an opioid, an additional opioid. He's much more interactive. I think you can tell that his coat looks much better. He actually did some grooming. He's, interested. Don't know about the tail, but he's definitely a different cat. and we are, we've palpated the wound and we're not getting that same, we're all over there. That's not a response. He's more playing with us. A very different cat. And then he's going to do a happy cat rollover, I think. And, or maybe an opioid-induced happy rollover. Okay. So I know he's upside down, but is that not a completely different face from, yeah. So, and lots of things about that video. So, wasn't really difficult, some opioids and some local anesthetic on the painful part of his wound, and we have a completely different cat. This is a dog post-amputation from a completely, smashed back leg, had an amputation. See what you think. And if you look at your GLASGOW pain scoring sheet in your handout, you might get some, an idea. You could actually go ahead and score her if you wanted. See, she's licking her lips. She's up, she's down. Yep, head is down. Now this is, you have to sometimes be a bit smart. Is that attention to the wound or is that personal hygiene? And you do need to sometimes look carefully. Sometimes it's personal hygiene, so you need to look carefully. That was not personal hygiene. That was looking, licking. And if you look at the GLASGOW pain score, that's something they should not be paying a lot of attention to the wound. She was restless, head down, licking her lips, uncomfortable, and restless. So lots of things on that GLASGOW pain scale. So what do you think of her now? Almost a stretch to get up, but she's only got 3 legs now. Couldn't care less about her wound, much more interested in playing, whereas before she didn't really want to interact much. Yeah. So, obviously when you look at before and after, but again, that first video, a lot of people say, that's not bad. But sometimes you say, well, we could still do better. Here's post-op spay. Position in the cage and posture. This is the day after a spay. Personal hygiene or licking the wound? It was licking the wound. Interaction, I'm not sure about you. Okay, so is she happy to see me? No. We're trying to sort of palpating the wound for, So what I got told was, one of the students actually came and said, I don't think that cat spay looks very good. The surgeon told me it was licking its wound too much and I should put a cone of shame on it. So what was the actual treatment was the cone, right? Was that the treatment that we should have? No. So I was like, no, look at her posture, look where she is. She was a friendly cat, and there's lots of things that tell us we should do something different. So we gave her an additional opioid. So she's still at the back of the cage, but not in that horrible hunched over. She was laying lateral. She is much happier. She really does want to interact with me. She's feeling much better. She wants to play. So I was like, I'm going to take your helmet off and then stand back and watch you. So I stood back and watched, and she didn't go back to licking her wound and doing all that stuff. So I hung her hat up and decided that she was going to do much better, and she did. So now that we can recognize pain and get a much better feel for it, I'm going to talk about how we take the nip out of snip. How do we actually make them look like all the good videos, and that we don't have too many of those really bad videos playing in our head, or us seeing those in our shelters or in our clinics. So there's quite a few key factors here, but what I do want to emphasize is that pain management, once you've recognized pain, is not complicated. So some of what we're going to talk about now is actually in the second part of the notes in your actual handout. But I just want you to be reassured that there are some very simple, effective strategies for keeping animals in shelters very, very comfortable.